Hello, welcome to Health Professional Radio, Health Suppliers segment. I'm your host, Neal Howard. Thank you so much for joining us today. In studio today with us is Mark Borsody, Chief Medical Officer at Nervive, and he's here today to speak with us about a new non-invasive medical device that treats stroke. It's called the VitalFlow. How are you doing today, Mark?
I'm very well, Neal. Thanks for having us on.
No problem whatsoever. Glad that you're here. Nervive Incorporated. Talk a little bit about Nervive above and beyond this new invention.
Nervive is a Akron-based company that we founded a few years back for the sole purpose of developing the VitalFlow Stimulator, which is a medical device that we intend to take to patients with various conditions of brain ischemia. Brain ischemia is most commonly encountered in the condition of ischemic stroke. So we aim to do that over the next few years with successive versions of our device. And since we last spoke a few months back, we've taken that first version of the VitalFlow into clinical testing.
Great. And are the results as promising as you anticipated that they would be?
They are. In fact, we've completed a study of 24 normal subjects, you could call them healthy volunteers, who were subject to 3 minutes of stimulation with the VitalFlow. And what we found is that stimulation is safe, number one, and most importantly, and also tolerable to the subjects, that in fact they could receive up to 3 minutes of stimulation with almost the maximum power that the device could put out. And what we found furthermore is that the stimulation increases blood flow to the brain, which is, of course, what we need the device to do in order to treat conditions of brain ischemia, such as ischemic stroke.
Now, brain stimulation, in my mind, I'm getting a picture of shock treatments. What are we talking about when we're talking about stimulating the brain and being non-invasive at the same time?
We'll get that a little bit now and then, Neal. The VitalFlow actually doesn't stimulate the brain directly. What it does is it stimulates a nerve called the facial nerve, which actually runs from the brainstem underneath the brain through the skull, in particular the temporal bone of the skull, where the ear canal is located. And so we use through specially designed stimulation coils for the VitalFlow, a shaped magnetic field that reaches actually under the brain and hits the facial nerve with minimal stimulation of the brain. So this facial nerve, just for background, is very well known to cause dilation of the arteries of the brain. It's a property of the nerve and nerve fibers that are carried along with the facial nerve to cause the arteries of the brain to relax and thus increase blood flow to the brain.
Basically, you can direct or pinpoint this flow of energy with this device. You can pinpoint it, and if you wanted to go someplace other than this facial nerve, you could do that?
Well, actually, you could not. The coils that generate the magnetic energy are very specially designed for this one purpose. And it is very much tied to the anatomy of the human head. And so it could not be readily applied to other parts of, for example, the central or peripheral nervous system. It's very much tied to the facial nerve.
Are you close to having it completed and ready to go on the market, or when do you anticipate that happening? And what about the fundraising?
Well, fundraising is always a bugaboo in startup companies, particularly in the life sciences realm. We have international patent protection around the design and use of the device. This is something that, the intellectual property is, of course, something that's always in development. The next steps will be, of course, to raise funds to carry us to the point where we can enter a first market with our current VitalFlow device. The clinical prototype that we're employing in our initial studies in man is in fact very close to that first market device. So it's just a matter of gaining regulatory approval for it through a humanitarian use pathway, and then taking that device out to patients. The patients that we'll initially be treating, though, are not ischemic stroke patients. We aim to use that first version of the VitalFlow as a treatment for a condition called cerebral artery vasospasm. It's a stroke-like condition that's found in the intensive care unit.
Now, you are rolling this out to be specifically in ERs. Is that correct? What about in nursing facilities? Have you do you have any, for lack of a better term, any takers that are just chomping at the bit, waiting on things to get finalized so that they can go ahead and start implementing your device in their practice?
Well, the second version of the device actually will be used for the emergency departments. And that will be a very compact, fully portable version that can be quickly and easily used in that crowded, chaotic environment of the emergency department. The very first version of the device will actually be used in that intensive care unit setting as the treatment for vasospasm. So in terms of the technology, we have, in fact, many interested hospitals that want to employ it. And we think that the uptake of the device will be quite good, even with that first version as a treatment for vasospasm.
As far as training goes, is it very simple to implement, or do you have a team of technicians that go out and train people? And once that takes place, as far as support is concerned, is that something that's readily available?
Well, we are looking for a device, and we intend to build that device so that it is very simple and straightforward to use. We want a device very much in the line of cardiac defibrillator, which, as you know, is now push-button technology.
Great.
This is something that is needed for disease, particularly in that second version of the device, where you're treating ischemic stroke. That's a condition where every hospital, every ambulance around the world is faced with ischemic stroke patients. And so we want a device that will be usable in that kind of environment.
Now, it is non-invasive, but is there any type of sensation that they will be aware of, or is this something that is simply going on within the brain, and this increased blood flow is taking place without them knowing it?
Well, the sensation that you receive when you're being stimulated, as we've been told, is somewhat akin to being tapped on the side of the face. Actually, on both sides of the face, of course. That's how the device works, because there's a stimulation coil on each side of the head. But the tapping sensation is one of the common side effects of the stimulation. And afterwards, the sensation that there's a sort of a warm blanket wrapped around the head. Not at all unpleasant, but definitely noticeable.
And where can our listeners get more information about Nervive and this new device?
Well, we post our information on our website, nervive.com, and of course we're publishing it in the medical literature as our studies get finalized and presented after professional society meetings. So those are the best routes, I think, to keep track of our work.
Great. You've been listening to Health Professional Radio, our health supplier segment. I'm your host, Neal Howard, and it's been a pleasure this afternoon speaking in studio with Mr. Mark Borsody, Chief Medical Officer at Nervive Incorporated. We've been talking about the VitalFlow, a brand new non-invasive clinical device that is really showing promise as far as treating stroke patients in the emergency room and in the ICU. It's been great having you here with us today, Mark.
It's been my pleasure, Neal. Thanks again.
Thank you so much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.